Hello everyone, and welcome to another episode of Ask Dr. Rockove. I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology in Portland, Oregon. And we've been answering questions that people have been sending us, and I picked out a couple this week that I thought were pretty interesting. And the first one was from a lady who said, please talk about things other than cancer. There are a lot of sites that do cancer stuff, but how about something else? Point well taken, and I think we'll do that. I can't promise that all these sessions will be free of discussions about cancer, because obviously in urology that does play a large role, but to the extent possible I will try to honor that request. And then another interesting question came from someone back east. The person said, my doctor says I need surgery for urine incontinence, but how do I know who a good surgeon is? Well, that's a tough question, and that's a landmine. But I do think that there are a few important things to try to cover with that. I'm going to take it on, and hopefully I'll take it on correctly. For the number of years, the practice and the specialty of doctors taking on problems such as female urinary incontinence, or other problems in that general area of female anatomy, which we refer to as the pelvis, which includes the uterus and the rectum. It was sometimes a urologist would deal with it, sometimes a gynecologist would deal with it, sometimes a general surgeon would deal with it. And what was becoming evident was that as information was accruing, as there was more science involved with it, that was just not optimal. And it was determined that for public health considerations that this become a specialty. And within the last decade, a medical subspecialty was created known as female pelvic medicine and reconstructive surgery. In order to be subspecialized in that board, you have to either have formal training in urology or gynecology, but then thereafter do additional training and then pass a comprehensive exam. So to be board certified in female pelvic medicine or reconstructive surgery, you can either be a gynecologist or you could be a urologist, but most importantly about either of them is that they've proven themselves to have expertise in the area and that they've been able to get additional training, which obviously is so important. That's not to say that surgeons who don't have these board certifications don't have abilities, but I'm just saying or suggesting that if you don't know someone, that one good way of filtering through is to find out whether that surgeon is board certified in female pelvic medicine or reconstructive surgery, or at the very least make sure that they've done fellowship training either in female pelvic medicine, either through urology or through gynecology. But you have to be extremely careful in just going to a general urologist or a general gynecologist, because unfortunately the reality is that very few people who are just generalists in either of those specialties ever got the subspecialty training, and many of them just acquired some experience afterward, but sometimes formal training and formal experience is much better. So that would be my answer to that. Thank you for the question.